Okay, so what is ICU delirium? ICU delirium is something that ICU patients get due to a combination of one, being in the ICU for just too long, and two, too many sedation medications. They all work together. So typically what you notice is a patient would be intubated for a while, probably getting heavy doses of propofol or fentanyl. And then, you wean all that stuff down in order to extubate because they can't be sedated without a breathing tube. And when you take the tube out and, the person's up, you'll notice they are just talking some off the wall stuff. Like the other day, I had one patient who was just convinced they were sitting at the bar and I was holding their bottle of Remy Martin hostage. Or, they think they're in their cousin's living room, or they think they're literally anywhere but the ICU hospital bed. And how a nurse is supposed to handle this situation is really to, one, assess neurological status. So this is how we determine whether or not a patient is alert and oriented times whatever. Times one is to person. Do they know their name? Do they know their birthday? Okay, they're oriented to person. Two, time. Do they know what month it is? Do they know what year it is? Do they know who the president is right now? I had someone tell me the president was Mitt Romney. I'm like, when did that even happen? So alert to time. And the third is situation. Like, do they know they're in the hospital? Do they know what happened? Do they think they're with their cousin? Do they think they're at a movie theater? Do they think, what is the situation? Where do they think they're at right now? What do they think is happening? I was actually trying to reorient a patient the other day, and they were like, come on, get me out of here. I'm about to walk out. And I'm like, do you know where you are right now? Yeah, I'm at Keisha's house. Okay, no, you're not at Keisha's house. Remember, you were in an accident. You're in the ICU. Your legs are broken. No, they're not. I'm about to walk out of here right now. I ripped the cover off. Please look at your legs. Please look at your legs. But you'll see, you can't, there's no arguing with a delirious patient. You will never win. And these hallucinations and these delusions are very, very real. I had someone tell me, another nurse, they're like, Kennedy, that patient isn't delirious. They know what they're doing. They know exactly what they're doing. And I look at the patient, I'm like, no, I think they're delirious. I truly do. And they're like, hey, pick those CDs up off the floor for me. I'm trying to watch a movie. And I'm like, these CDs? And they're like, yeah, those ones. And I take my leg and I kick the CDs as hard as I could. And the patient looked at me and they were so sad. They were like, now, why would you do that? I felt horrible.